welcome you all to this first international conference on breast cancer. This was the dream when we started research in the Department of Bioresource in 2018 around on triple negative breast cancer, which is having the highest incidence in our valley, because the Nagpur is the first city which is having around 35% incidence, and Kashmir is Srinagar city is having around 33% incidence. So we are the second one having the highest incidence of triple negative breast cancer. So we started on the triple negative breast cancer in 2018, and since then we have been publishing the papers regularly. Besides that, we published almost 10 books on different aspects of cancer with leading publishers. Then in 2021, under the Honorable Vice Chancellor's guidance, we started this breast cancer awareness, because awareness and extension services is a part of the universities, the research, the academics. Besides that, the extension services, when Professor Nilofer Hassan Khan Sahiba told me that about we need to move ahead and spread the awareness about this dreadful disease. So we started the awareness campaign in 2021, we continued through that in 2022, and still it's going on. We traveled to a lot of colleges across to that. We asked them to be the brand ambassadors to spread the disease. Because when we talk about the cancer, it is having a lot of social stigma associated with it. It's not only that, because people are not having the awareness. We are having a myth: once somebody is diagnosed with the cancer, it means the end of the life. It's not the end of the life. If cancer is detected at the earliest stage, in that terms, we can say that the cancer is a beautiful disease like others. It gives you a timeline, it gives you a time frame. If it is detected early in the stage first, then we can very well treat it with different types of therapies on treatment options like chemotherapy, radiotherapy, then surgeries, targeted therapy, and immunotherapy and all that. This conference is to bring all the stakeholders on one platform. We are having the policymakers here, we are having the doctors and paramedical staff, we are having the principal, and we are having the director of schemes also here. Besides that, the vice chancellor and the entire administration of the university is here. So we want to bring them all together so that the awareness campaign, because awareness is the only key how we can prevent ourselves from this breast cancer. More the awareness, because we are fortunate enough that we have smart gadgets in our hands, but there are very much large population of this part of the valley who don't have those facilities available. So we need to spread that word by whatever armament we have to those nooks and corners, and we want you who have come from different colleges or different medical institutions or hospitals to spread this word of awareness and hold local seminars, then workshops and others, so that this cause of breast cancer awareness, breast cancer education, and what are the treatment options available, and at least facilitate the people, because we need to join hands all. It's not one body's, it's the researchers, the medical staff, the policymakers, and the doctors who need to join hands to spread the awareness and facilitate the patients who had been diagnosed with breast cancer already.
Pertaining to breast cancer awareness and diagnosis, University of Kashmir has played a very pivotal role in the society, not only now, long back. We have a professor from biotechnology here, high-end research on, cancer they are doing. Of course, the breast cancer also. So keeping in view the high-end research and having equipment for it, the University of Kashmir has an art of, well-developed infrastructure of research worth crores, equipment which the university has got from the various grants which we receive from Government of India. You'll be happy to know that today we have one of the reviewing meeting of all the grants that we have received, and the experts are so happy. One of them is NCBS director from Bangalore, who's present himself here, and it gives us encouragement, it gives us strength when they tell us that the University of Kashmir is going in the right way. So similarly, having these types of awareness program is needed, is very much needed. As somebody before me, I think Bhagat Saab said that it needs wider collaboration. Yes, it needs wider collaboration. We have other departments on the campus who are doing similar type of work, not to this extent, because this particular conference was very generously funded by DST, but university from our own resources, we pool in our own funds and have these types of programs. So keeping in view the importance that it has, our Women's Studies Center very much involved in having these types of programs, home science, clinical biochemistry, our nanotechnology, and even our primary health center. I'm so happy that our doctors keep on having various awareness camps, whether related to breast cancer, whether related to eye health, any type of that awareness that is needed, they do it. But of course, keeping in view the role University of Kashmir has to play in JNK, definitely University of Kashmir has to frame a certain roadmap, in a way how the other departments within our own campus, within our own university can have different portfolios in order to achieve this objective. See, for example, if we are meeting today, after 3 days all girls will go to their respective institutes, they have forgotten, but we have to have that connection with them, have that permanent connection with them, keep on awareing them, go to these institutes, and of course in this different departments can play a role. Biotechnology is there, bioresources, of course, home science, women's studies, clinical biochemistry, nanotechnology, and our health centers. So I look in this, and definitely the recommendations which will come from this conference will go a long way, not only pertaining to the research that we have to take up in the university, not only the awareness camps we have to take in the university, but also the recommendations for the policy makers that can be implemented. Very well said by Bhagat ji about these implications, because it is interconnected. Awareness camps aap karenge, research karenge, but at the ground level, it's the policy implication which matters. And I'm happy Ifaji was just now saying, awareness should be made amongst the, above 40, above 45 age group women, that there is mammogram facility at GMC, and definitely women should aware that facility in GMC for this, diagnosis, so that God forbid if any, I specifically used in the documentary nip the evil in the bud. Definitely if there's any evil in our body, let's kill it at the beginning, let's kill it at the starting point. And there are various research studies which prove that things taken at the right moment, things corrected at the right moment can be cured. And definitely our SKIMS is doing a remarkable job, our GMC is doing a remarkable job for the healthcare of women. I have been witness to so many patients over there whom we referred, due care was taken, and they are all healthy now. For the information of Ifaji, long time back we did one awareness screening camp with SKIMS, and two of our employees on the campus were diagnosed with early detection of breast cancer. Now they are still working in the campus but healthy. So why I say this is, these small gestures, these small events really can save life. If we have saved life of 2 women, they have definitely we have saved life of 2 families. So many are interlinked with them, their children, their family, their parents, their relatives. So this is this. So definitely I am sure this camp will also help. and in future also University of Kashmir will definitely take up this responsibility, will shoulder this responsibility in a wider perspective. We have around more than 209 affiliated colleges scattered in all the districts. We'll definitely reach out to them in a joint manner, taking biotechnology with us, taking health center with us, taking the other relevant departments with us, home science, women's studies, and even the health department of our UT, and definitely, the objective will be, obtained, that is health for all, and especially what is our objective is women should be healthy. Women are the nucleus of family. They have great responsibilities. They can only, shoulder the responsibilities of their professional as well as familial, responsibilities when they are healthy, psychologically healthy, and physically healthy. So it's duty of all of us to see that health prevails in all families, and for that University of Kashmir, any program we have to do, any program in collaboration, any small programs we have to fund which is within our reach, we'll definitely do it. With these words, I once again congratulate the organizers of this particular program, but believe me, there's still a long way to go, and I'm sure jointly we'll move forward and obtain this objective till our UT becomes cancer-free UT, and definitely University of Kashmir can play a great role in it. Thank you very much.
In fact, it is a matter of great satisfaction that University of Kashmir is organizing this 3 days international conference screening camp on one of the important issues of public health, breast cancer. University of Kashmir being the premier academic and research institution in this region is fully conscious of its social obligations and responsibilities which have been mandated under extension activities so far as the universities in this part of the world is concerned. In fact, Department of Bioresearch, University of Kashmir has been on the forefront in spearheading the campaign of awareness regarding the breast cancer. Mostly we have focused and targeted the effective institutions at higher secondary level and the college level, which could play a very important role in the campaign of awareness so far as the breast cancer is concerned. The present event holds a very significant eminence in the sense that this particular disease impacts a larger section of the population, which by different indicators of socio-economic and demographics have been underlined as one of the important marginalized sections of the society. If we are going to just analyze the variations in the incidence of the different fatal disease, they are gender specific so far as their incidence is concerned. Already very important statistics have been quoted regarding the incidence of this disease. As we know that so far as the Indian scenario is concerned, the incidence of breast cancer, it has taken the lead over all the various types of the cancers. And particularly among the female folk, where its incidence is almost 28%. That is very alarming. Again, the statistics is shocking that if we will see one of the reports of the World Health Organization, that in every 9 persons, one person is going to just face the problem of the cancer in his entire lifespan. That is very shocking. And more shocking is that so far as this disease is concerned, its vulnerability was among the age group of beyond 30 to 50 years. Now there have been the reports that its incidence is shifting to the younger age group, even beyond 20 years age. That is quite alarming.
I feel that a university with a strength of 17,000 students and multiple campuses and with such a large faculty, I think the message of awareness regarding breast cancer and this 3-day research program will not only go to 17,000 houses, but maybe several thousand people across the state. And I think therefore the Kashmir University is a very good platform for such an important cause. Whenever a family is impacted by this disease, and I have personal experience in my extended family, it is very devastating. And most importantly, as we realize that it not only impacts the family for a short time, but for a very long period of time. At the national level, the broader research indicates that there is almost 27% of incidence of this disease in newly detected cases. And when we take the age group cohorts, between 20 to 49, 37% detection is happening, which is a fairly early age group. Between 50 and 69, 46% of the cases are detected, and above 70, the number is smaller, say around 15%. And in case of urban, the recovery rate is 1 out of 22, while in rural areas, 1 out of 60, which indicates that there is a lot of divide between the urban and rural areas. As a public policy practitioner, it is important from the government's point of view that such kind of conferences, after the research and after the input from various delegates who've come from various parts of India, and also from the departments of health, Department of Higher Education, and other departments, can give it their inputs to the government to change the public policy wherever it is required. Which is the selected group which we need to work on? Do we need to work on rural areas more or the urban areas more? Another very alarming thing is that the incidence in the Kashmir Valley is much higher than the rest of the country. While we are very good in other parameters, health parameters, we are in fact the third healthiest union territory or state in India in other maternal and child health parameters. But why in this particular parameter we are having high incidence? Is it the dietary factor? Is it the Vazwan? Is it the lack of exercise? Is it the lack of care in terms of the maternal child care? Or is it the socio-cultural factors which prevents the rural women from coming to the health systems? I think on this already Director Skims and Principal GMC has shed light on the factor that they have now put in a lot of female health workers, female doctors, which will improve the number of women coming for detection. But I think what is very critical is that the lifestyle factors, the balanced diet, non-use of alcohol, reduction of smoking, encouragement of breastfeeding, the misuse of HRT, hormone replacement therapy, radiation exposure, which has been raised by Registrar Saab, and in much detail, that how the radiation is utilized beyond what is required. The incidence of the BRCA gene, which also runs through families. I know certain families where almost the grandmother and the next generation and right till the granddaughter, everybody has suffered from the incidence. So in such kind of cases, maybe some kind of early intervention can prevent and save lives. Facilities for mammography, then some chemotherapy options are there. All this is very, very critical. But I think what is important is that from the public policy point of view, what I would request Vice Chancellor Madam is that after the 3-day conference, if a set of suggestions for the government, for the health department can come up, and also we have a very good system of the ICDS, where we have a set of Anganwadis across the country, which not only concentrate on the 0 to 6 year nutrition, but they also work on adolescent health. And if they are also trained about the awareness program, we can reach out to a very large number of women. Other than this, also some kind of mechanism of, we have Ayushman Bharat, and J&K is one of the, perhaps the only union territory in India where up to 5 lakh rupees there is complete medical insurance. And we have given medical insurance to everyone irrespective of their economic level. So everybody sitting in this room is insured if you have a gold card. So therefore, is that gold card covering the breast cancer interventions or the various kind of diagnostics? And if it is not covering, we need to actually write to the health department to cover them properly. Are the various packages there, mammography or for that matter any other package, is it to be developed? Because when government is spending huge amount of money on the insurance premium covering every single family of J&K, 26 lakh families of J&K, 1 crore 25 lakh population is covered through the system. So is it covering the breast cancer interventions? And secondly, are the hospitals ready to provide the interventions? These are very important factors. Other than this, we can also develop some specific tertiary hospital specifically for this niche area. So we have a general cancer hospitals are there, but can we develop those tertiary hospitals? The new hospitals which are coming up in J&K, like the AIMS which is coming up, or the ESIC hospital in Ompura is coming up, can we develop especially breast cancer cells in those areas? And also in the curriculum of our education, in the university level, school level, can we have specific chapters, something like the content developed by Manzoor Saab? Can this be endorsed and can this be part of the syllabi of our state board and the universities? I think these are some of the issues I would like to highlight.
I am sure that although the department like our bioresource and we have very talented scientists, professors who are doing a very great research in the cancer, in the Department of Biotechnology, in our city, in our other centers. But there is a lack of awareness. See, we are meeting today in this conference hall. If we see our participants, mostly many of you are related with the medical profession, many of you are related with the university, many of you may be related with the different institutions. But what to a common man who is not in the university, to a common woman who is not in the university, who is not in any institution? So actually we need to have the awareness for them. We read the literature, we go through the news, but we have to make the awareness to the people who don't know anything. And I would request, since Dr. Manzoor and his colleagues have taken this initiative, and I would request them that this initiative needs to be taken at the grassroots level. As I said that there are treatments. Whenever there is any patient who is diagnosed with a cancer, the medication is there. Then we talk about the radiotherapy or we talk about the chemotherapy. But I have some personal remarks. Since Principal GMC is here, the director of the schemes has just left, but I am sure that there may be some other people from the schemes here. Have we ever thought that whenever we go for a radiotherapy or a chemotherapy, what kind of radiation protection measures, what kind of protection measures are to be taken? When we go through the literature, there are a lot of protection measures. For example, when we go for a radiotherapy in schemes, we have a cobalt-60 there. Of course, now the new machines have also added there. But I have seen that we lack even the awareness in the radiation worker who is not fully aware that how much this radiation is dangerous to us. And then to a particular patient, when we visit the hospitals, for want of any X-ray, for want of any ultrasound, for want of CT scan, for want of anything else, where radiation is to be imparted. Can we see? We have seen it a number of times. The radiation worker who does this and the attendant are sitting inside because there is a lot of There is no awareness. If we see the National Council for Radiation Protection, there are bylaws. Why I am talking about this? Because Principal James is here, and then the other people from the associated hospitals must be here. Whenever there is a cancer patient who is undergoing the radiotherapy, it is written in the bylaws that there should be a board written on the outside of this lab. The name should be ALARA, A-L-A-R-A. That you have to use these radiations as low as reasonably achievable, so that the time is less, the distance is less, and shielding should be more. We are debating on this cancer, we are debating on the breast cancer, we will be debating on different kind of cancers, but at the same time, we need to take a call about the treatments. Although the government has been doing a lot, there is always a support from the government. But we as the worker, we have to be well educated. As I was just saying that, we need to bring this awareness to the grassroots level. I would be very happy if Manzoor Saab can coordinate with our Directorate of Lifelong Learning, with our other center, where this awareness can be taken at the village level. Because we need to take this awareness there. There are symptoms of the breast cancer. So maybe our people don't know. So we need to show them, we need to tell the stories to the people. Rather than, because the participants, yes, we can debate on the technical sessions. We can debate on the improvements. We can debate on the research, which is related to the breast cancer. But we need to take this awareness at the grassroots level.
This international conference and free screening camp represents an important step forward in spreading awareness about breast cancer, offering a platform for knowledge exchange on early diagnosis, prevention strategies, and fostering research into cutting-edge treatment approaches. I congratulate the Department of Biosources, University of Kashmir for organizing such a meaningful event, which includes valuable initiatives like a documentary screening and the launch of a comprehensive book on breast cancer. Here I would like to acknowledge the tireless efforts of GMC Srinagar in delivering quality healthcare service to cancer patients, especially those having breast cancer. Our institution remains committed to providing the best care and support to those in need while continuously engaging in collaborative research endeavors. Here I would like to communicate to the young audience that is here, and especially our females who are here, that this is a time they should shy away from talking about breast cancer. You'll be all happy to know that we have female radiologists who are available, female surgeons and female oncosurgeons too in our institution. Usually young females shy away when they see something wrong in their breast, like every lump in the breast is not cancer. And it's important that you understand that. But if you feel there's something wrong in the breast, like whenever you palpate the breast and you feel that there's something, a nodule there or a lump there, or there's a lump in the axilla, or something wrong with the nipple, a discharge from the nipple or retraction of the nipple, please don't shy away. It's time that you reach out to us. We have at your service female surgeons too, who can initially see whether the lump needs some investigation. We have female radiologists, and we have a very good pathology department where the confirmation of a lump can take place. And if at all it is breast cancer, it can be helped by our oncology department, the medical oncology, surgical oncology, and then the radiation oncology department. So it's important that you are aware about the signs and symptoms of breast cancer and reach out to your healthcare providers.
I think we are focusing too much on tertiary care, more on treating, how to treat the patients. But what I am focusing on, as a physician, I have been trained to treat one patient at a time. But for last, I would say probably 25 years, I have focused more on how to prevent a patient from becoming a patient. I think that's what is important. I think that's what is critical, and I think that's what brought me here to be amongst you all. I would urge, I see a lot of students in the audience, I think spread the message. I think use the social media. I think you are the future, and you people will provide the answers to all the problems. I think one more thing is important, particularly for students. Ask questions. Don't think that all the solutions have been found. So learn to ask questions. There's not a stupid question. There can be stupid answers. Ask questions. Ask anybody. Because that's where the innovations will come. That's where the new treatments will come. And most above all, I think I would thank Dr. Mansoor for creating the awareness in rural areas of Kashmir and all over. I think that's very important. I think that is where we need to focus on. I'm rather shocked that only 50% survival rate in the rural Kashmir. I think that is inexcusable. I think we should focus more on rural areas also. And I had the privilege of working in Iraq, where we were able to bridge the gap between the rural Iraqis and the urban satellite centers like Baghdad or in Basra. So we can replicate that model in Kashmir.
Health is wealth, and there is no doubt about it. A person may manage to survive and stay happy without money, but can't do so without good health. Staying healthy is indispensable for a person to enjoy his or her life to the fullest. While talking about health issues, one of the most frightening names is cancer. A cancer diagnosis can affect the physical, mental, social, and emotional health of patients, families, and caregivers. Cancer that impacts the whole globe needs to be understood. There are more than 200 types of cancer. Among females, most commonly found cancers are breast cancer, colorectal cancer, endometrial cancer, lung cancer, cervical cancer, skin cancer, and ovarian cancer. Breast cancer, the most common type of cancer in female worldwide, represents almost 25% of all cancers in women.
All of us know that breast cancer rate is alarming, and it's increasing day by day. Our valley is one of the places where statistical data shows that for last 5 years the statistical data has drastically increased. So there is a need that educational institutions play their role if we can nip the evil in its bud only. I think this present awareness will be really great beneficial to our society.
One among the prominent cancers across the globe is breast cancer. And if we talk about the statistics, every 3 minutes a woman is diagnosed with breast cancer, and every 13 minutes a woman dies because of the breast cancer. These are not only the statistics, but these are the tears rolling down from the families of those people who have cancer patients in their families.
Now, breast cancer is one of the topmost 3 common cancers in general population in all over the world. In fact, internationally it is the number 1. And in India also it is in top 3 cancers, and in women it is the number 1 cancer. It has come in the recent data.
Breast cancer can be divided into stages based on how large the tumor or tumors are and their expansion.
A small lump in the breast or a lump in the armpit or a bloody discharge from nipple is something that you should be aware of. It can have some connotations, but every small lump is not breast cancer. So that is important that it's important that there is some awareness about breast cancer. And in this month, in our institution also, we are spearheading some camp programs and campaigns for making people aware about breast cancer.
Breast cancer is treated in several ways. It depends on the kind of the breast cancer and how far it has spread.
Most of the cases can be evaluated and can be treated in Kashmir easily without any problem. There will be very few situations where certain modalities which are still not available in the valley, for which a patient might need to take an opinion from outside. But I would say that will be 1 in 100 cases.
At Sikkim's, we have a proper breast clinic. We have a department of medical oncology. We have surgical oncology. We have radiotherapy, and we have nuclear medicine. And all these departments are actually one or the other way related to management and treatment of breast cancer.
As of now, scanty of work has been done on this high-intensity disease. In this regard, University of Kashmir at Department of Bioresources has started in 2019 to work upon the same problem. And therefore, our lab at Department of Bioresources is trying to indulge its efforts for contributing a little to the already done research in breast cancer by taking the concept of drug repurposing into consideration.
We have a full-fledged Department of Medical Oncology, Surgical Oncology, Department of Surgery and Radiation Oncology. So all the things that are needed in the treatment of breast cancer are available at GMC Srinagar.
Awareness is the key to early detection and better health-seeking behavior. Cancer is quite common in both developing as well as developed countries. But awareness is yet poor among general population. Poor awareness may lead to poor uptake of screening modalities and delay in diagnosis. October marks the National Breast Cancer Awareness Month. Department of Bioresources, under the headship of Dr. Manzoor Ahmed Mir, initiated breast cancer awareness programs in 2021 and continued it in 2022 by visiting various degree colleges, demonstrating his commitment to educating the younger generation about this critical health issue. His efforts not only fostered a culture of awareness and early detection, but also empowered students to become advocates in their communities.
I am also happy to tell you that through this bioresource team who are making these awareness programs pertaining to breast cancer, they went to 15 colleges which are affiliated to our university. They made awareness programs over there.
The response of the principals, teachers as well as the students was satisfying.
जो awareness हमको मिला इस प्रोग्राम की वसात से, it was extremely excellent and very informative.
I think this was quite fruitful, and I believe that such kind of programs should be organized in future also.
इससे हमें बहुत ज़्यादा अवेयरनेस मिली एंड सबसे पहले कि जो हमें बहुत सारे मिथ्स होते हैं इस कैंसर के बारे में वो भी हमें पता चला और प्रिवेंशंस के बारे में पता चला और हम लोग कैसे इसको पहले डायग्नोज कर सकते हैं वो भी हमें पता चला. मैं इतना ही कह सकती हूँ कि ये जो प्रोग्राम था ये बहुत ज़्यादा फ़ायदेमंद था.
जो ब्रेस्ट कैंसर है ये कितना ज़्यादा इम्पैक्ट कर रहा है पूरी दुनिया की औरतों को, तो इस सेशन से हमारे जो स्टूडेंट्स हैं उनको अवेयरनेस हुई. नाउ दे विल एक्ट एज अ ब्रांड एम्बेसडर्स, दे विल एक्ट एज एन एम्बेसडर्स एंड दे विल वर्क ऑन इट एंड दे विल शेयर दिस वेरी information whatever they have gathered from the session with the other members in their family.
With the aim of spreading awareness, the department organized various online as well as offline conferences. One of the important initiatives in this context was the National Breast Cancer Conference that was organized in November 2022. This event served as a crucial platform for healthcare professionals and experts to share knowledge, resources, and support. And it also included free breast screening services for attendees. The conference highlighted the importance of collaboration in combating breast cancer, facilitating discussions on the latest research, treatment options, and strategies for awareness. In recognition of Dr. Meer's significant contributions, he was honored by the Honorable Governor for his outstanding efforts in breast cancer awareness and research during the Kashmir Expo 2022 at SKICC, Srinagar. This recognition reflects his unwavering dedication and impactful work in educating the community about breast cancer prevention and early detection. Breast cancer awareness is not just a month, it is the awareness throughout the year, throughout the whole globe.
We don't want that we should stop here after 1 week. This message should be awareness message, should keep on moving till we make our masses aware. That's very important.
Once you have got a diagnosis of cancer, that doesn't mean that you will stop living. But the thing is that you have to strive to get the treatment for it and move forward in life. I myself, being a person who has actually had this kind of a diagnosis at one point of my life, but fortunately it was diagnosed right in time, treated and operated at SKIMS, and I am doing absolutely well.
So let's aware ourselves first and then others. Keep eye on the signs and symptoms. Do your breast self-examination regularly and keep in mind the preventive measures.
We are also, planning to have an international breast cancer conference in our university, so that we come to know through different resource persons where the things are wrong, that such an alarming statistical data is coming up of the breast cancer. Is it dietary, is it lifestyle, is it related to stress? So we want to see through different resource persons where to correct what.
Our Department of Bioresource under the headship of Dr. Manzoor Ahmed has already done certain programs regarding the breast cancer, and I'm happy to see that he has also given some very prominent public talks in different colleges, in different schools regarding this breast cancer, because we know that this cancer is a very deadly disease. We all know it, and particularly in case of women folk for the last this around a decade or more than that, but we have seen that even this cancer is there, God forbid, this cancer is there, but people don't know. So the main aim of this conference will be to get people aware, and in fact you can have the very random check of the people. It's not necessary that whether you have symptoms or not.
This international conference is witnessing renowned experts in breast cancer from both national and international realms, encompassing a wide array of disciplines within the scientific and diagnostic fields.
I congratulate the Department of Bioresources, University of Kashmir, for taking the lead in bringing out this first international conference on breast cancer awareness, and I'm sure the deliberation in this conference will be fruitful to all the delegates who are present there, and also to all the students who will be attending this conference.
Taking breast cancer awareness into consideration, Department of Bioresources, University of Kashmir has also developed a comprehensive breast cancer awareness website where all the information about breast cancer is available to the general public free of cost. Moreover, University of Kashmir has signed an MOU with Jammu Kashmir Science Technology and Innovation Council regarding the collaboration in research and extension activities. And this breast cancer awareness campaign of Department of Bioresources is a part of that.
This month being the Breast Cancer Awareness Month, we should hold more and more programs across the societies, in this media, NGOs, government associations, schools, colleges, universities should take a leading role to make our women aware of the presentation of breast cancer and how to pick it up early.
Spread the word against breast cancer, aware the people, use your different social media platforms like Twitter, WhatsApp, Facebook, whatever is available with you regarding the breast cancer awareness, and then how to avoid this, what are the preventive strategies. With this, we will surely be able to defeat this breast cancer.
Last but not the least, if detected with the breast cancer, it is not the end. You have to fight cancer with hope, and you will definitely win over this race.